I've been a doctor for over 20 years, huge interest in women's health, and I'm happy to see any woman for any issue. I've worked as a GP for over 15 years. At this stage I feel like there's nothing I haven't really seen. Whether a woman is still looking for contraception or fertility issues, perimenopause, menopause, postmenopause, I'm happy to see everyone. Filling out the questionnaire.
No problem.
It's really helpful just to have that information on file. Know what you're coming in with, and then we can kind of target the consultation a little bit. We can go through things in a bit more detail if that. So to begin with, there'll be lots of chat, examinations depending on what comes out in the history, your blood pressure, and we'll check your weight today. We might do some blood tests if that would be okay. You probably saw from the first bit symptoms that would indicate perimenopause, menopause, palpitations. Lots of women get things like that, or feeling a bit anxious, not knowing why you're awake, but not being able to get back to sleep, frustrating, panic symptoms, things like that, or feeling very fatigued. Really good information, and I'll send you some links afterwards. So I think it's really important that when blood tests come back that we have a full in-depth chat about that. I'm really lucky with the lab that we use that they do a really detailed report, but if we take a test we need to explain that test result to the patient. A very specific plan around that in terms of whether we need to make any lifestyle changes or medication changes and when we should retest. So I think that's vital. So I've been inserting coils for over 15 years at this stage. And I set up a clinic in the Coombe in 2020. I worked in Holland Street before that, solely putting in coils. So I feel very comfortable with the insertion and removal of coils. I'm delighted to be able to offer that service here in the Dr. Dallas clinic, and we're really lucky to have the option of being able to use local anaesthetic injection if needed to make the procedure more comfortable. We can also offer all of the different forms of intrauterine contraception, hormonal coil or a copper coil, and we can talk through all the differences between them and find the one that's best for each individual woman. We're very lucky in this clinic because we have, when a patient attends for her health journey, they come in and they meet one of our amazing skin therapists who does a full skin assessment with them, talk to them about their skincare routine, advises them on what would be best. The patient comes in to me and we sit down and we go through really detailed, comprehensive medical history, talk about all of the symptoms that the woman is experiencing. We do a cardiovascular risk assessment, we look at osteoporosis risk, we look at breast cancer risk, we'll do some measurements, weight, BMI, height, blood pressure, and other examinations as needed. We'll make sure that things like smears and mammograms are up to date, and we'll decide what is best for that individual patient in terms of whether she wants to try hormones, depending on what stage she's at, or if she wants to talk about some of the other options available. If you'd like to find out more about women's health, what's going on for you, perimenopause, menopause, or any other issues, please book in for a consultation with me today.